Humana people to people in support of the 90-90-90 target. By 2020, UNAIDS has now set the goal of 90% of all people living with HIV will know their HIV status. 90% of all people diagnosed with HIV infection will receive sustained antiretroviral therapy. 90% of all people receiving treatment will have viral suppression. The target is clearly set with the 90-90-90 vision, leading to gain total control of AIDS, the epidemic, by 2030 must be realized, preventing illness and death, averting new infections of millions of people. Ending the AIDS epidemic depends largely in the world's ability to provide the resources for HIV treatment to all who need it. Universal access to treatment is critical, and this can't be achieved without the people in the lead. So, communities must be mobilized to act. The idea of Humana People to People's HIV/AIDS program, TCE, Total Control of the Epidemic, is built on the thinking that only the people themselves will be able to set each other free from the threats of the epidemic. It has to become a collective affair. UNAIDS is the world's common agency for the fight against HIV. UNAIDS makes a yearly report on how the fight against HIV is moving. Also, in 2014, where Michelle Sidibe, UNAIDS Executive Director, among others, writes, "There will be no ending AIDS without putting people first, without ensuring that people living with and affected by the epidemic are part of a new movement. Without a people-centered approach, we will not go far in the post-2015 era." Even though we have seen new HIV infections drop by 38% since 2001, there were 2.1 million people newly infected in 2013. There are also 22 million people who are not accessing life-saving treatment. If part of the success we have seen comes from what gets counted gets done, then it is time for everyone to be counted and reached. Increasingly, we are seeing multiple epidemics in countries. Never has it been more important to focus on location and population, to be at the right place for the right people. We have a fragile 5-year window to build on the rapid results that have been made. The next 5 years will determine the next 15. Working together, ending the AIDS epidemic is possible, and it will take leaving no one behind. Some facts from the report on the status of the epidemic. Of the 35 million people living with HIV, 24.7 million, that is 23.5 million to 26.1 million, are living in sub-Saharan Africa, the region hardest hit by the epidemic. Nearly 1 in every 20 adults is living with the virus in this region. Almost 4.8 million people are living with HIV in Asia and the Pacific. Of the 35 million people living with HIV in the world, 19 million do not know their HIV positive status. Adolescent girls and young women account for 1 in 4 new HIV infections in sub-Saharan Africa. However, some 86% of people living with HIV who know their status in sub-Saharan Africa are receiving antiretroviral therapy, and nearly 76% of them have achieved viral suppression. AIDS-related deaths are declining. Fewer people are dying of AIDS-related illnesses. In 2013, there were 1.5 million, that is 1.4 million to 1.7 million, AIDS-related deaths. AIDS-related deaths have fallen by 35% since 2005, when the highest number of deaths was recorded. In the past 3 years alone, AIDS-related deaths have fallen by 19%, which represents the largest decline in the past 10 years. The number of AIDS-related deaths decreased significantly between 2009 and 2013 in several countries, including South Africa, 51%, the Dominican Republic, 37%, Ukraine, 32%, Kenya, 32%, Ethiopia, 37%, and Cambodia. We can end the AIDS epidemic with a concerted effort of all mankind. The knowledge and know-how is available, but it can only be achieved with the people at the center of the global fight for this to happen, and the international community make the resources available. Humana people-to-people AIDS experience is gathered from the past 15 years, fighting HIV and AIDS together with each individual, each village, each community, and entire districts in 12 countries in Africa and Asia. Humana people-to-people's contribution to the 90-90-90 target will immediately be to achieve the first 90, meaning that 90% of all people living with HIV will know their HIV status. This is then what we do. It starts with testing the individual for HIV in the areas where there are high HIV prevalence and TB infection. We engage each person into a dialogue where issues about HIV and AIDS are discussed in depth, addressing fears and concerns of each individual until we reach a clear understanding with the person of why HIV testing is important and the entry point to HIV treatment, which may improve their health and prolong their life. The individual is then offered HIV testing in the comfort of their homes by trained community health workers who walk or cycle from house to house. Each individual is tested for HIV based on their consent. The house-to-house approach also gives a chance to the individuals to engage their sexual partners, so they are tested as couples. The community health workers are trained in couple counseling as well. It is very important for couples to make informed decisions about their sexual life together. Issues of disclosure amongst partners are made easier as they are dealt with in the household and upfront. Tuberculosis remains the leading cause of death among people living with HIV. Tuberculosis remains the leading cause of death among people living with HIV. In 2012, people living with HIV accounted for 1.1 million, 13% of the estimated 8.7 million people who developed tuberculosis globally. What is needed now is a systematic TB case finding, as many people with TB are still not found, being treated and cured. During the counseling sessions, a process of TB screening is also entered into, with the Humana people-to-people community health worker going through a set of questions pertaining to signs and symptoms of TB. This is because the current trend is that, for example, in sub-Saharan Africa, 60 to 70% of people living with HIV have co-infection of HIV and TB. An individual who experiences the signs and symptoms is referred for TB diagnosis at the nearest health center. Volunteers are also trained by the community health worker to assist to screen and systematically find people who have signs and symptoms of TB within the communities. Sputum collection is also organized and samples taken to the microscopy centers and the results brought back to the person. 3 of 5 people living with HIV are still not accessing antiretroviral therapy. 22 million, or 3 of 5 people living with HIV, are still not accessing antiretroviral therapy. The proportions of people who do not have access to treatment are 58%, that is 56 to 60% in South Africa, 64%, that is 55 to 72% in India, and 80%, 79 to 82% in Nigeria. South Africa has announced a bold target of providing 4.5 million people with access to antiretroviral therapy, which would mean that around 80% of the HIV positive are on treatment. This is how Humana people-to-people contributes to the second 90. After people tested for HIV by the TCE community health worker, each person who tests HIV positive is referred to the nearest health center to have their CD4 count checked. A close follow-up will be done to secure that the CD4 count is done, as this determines further action. Follow-up is done through home visit, by calling on phone, or by sending SMS. People are comfortable when they are tested in their own homes. Here, people who would rather not take an HIV test because they feel healthy will opt for an HIV test because the service is at their doorstep. This is where the home-based testing is effective to reach all the people, also all those who are living with the HIV virus but are not aware of it because there are no signs of illness, and still today 55% of the people are not aware of their status as they have not been tested. This is a major obstacle in reaching the first 90 of the 90-90-90 target, finding the 90% who are HIV positive. For example, in South Africa, 105 TCE community health workers have, in 2015, over 6 months, tested 68,907 people in some districts of Eastern Cape and in Mpumalanga, with high HIV prevalence, and 5,191 people tested HIV positive and referred for CD4 count at local clinics. In Zambia, TCE has, during the same period, tested 93,000 people with 90 community health workers in high HIV prevalence areas of Lusaka, with 9,423 people tested HIV positive and referred to local clinics for CD4 count. We need to scale up TCE, which has proved to be an efficient program implemented in 12 countries, reaching out to 20 million people over the past 15 years by 10,000 well-trained TCE community health workers.